Minister of Health Dr. Frank Anthony said on Thursday that in-depth analytical studies will soon be conducted to better understand the contributing factors that are responsible for the continued vaccination hesitancy in the country.
We have a program that we're working on right now, which we're hoping to start rolling out in Region 1 with those villages that have been more hesitant than others. And then we'll do subsequent rollouts in different areas.
A number of areas, such as Region 10, continues to show hesitancy towards accepting the COVID vaccines. As of Thursday, just 17.1% of the adult population in Region 10 had received a first dose of a COVID-19 vaccine, while only 9.1% of the population is fully immunized. The minister said that the ministry now has to move from a broad approach to a more specific target methodology to find a solution to this issue.
It's a lot of work to try to figure that out, and also then to design a new approach to see whether or not we can encourage more people within those areas to take their vaccine.
Authorities of Region 10 have blamed the lack of education coupled with vaccination myths as the reason for the existing vaccine hesitancy. But according to the Minister of Health, social media has contributed significantly to this problem in Guyana, since persons are easily bought by the information they hear and see on social media that are oftentimes nonsensical.
You have to analyze the information that you sometimes see on Facebook. You have to use your brain and think about what you're seeing and what is being said, and use your better judgment to identify the nonsense and to remove that, and to see whether this thing is nonsense or it's making sense.
On another note, the minister has cautioned citizens against laminating their COVID vaccination cards, while advising that they find other means of protecting them until the ministry successfully launches a digitized version of the card. More so, it was also announced that the government of Guyana continues to actively pursue the COWIN software from India.
And they have consented to give us a customized version of that software for our use. So we are continuing those discussions, and hopefully as soon as we finalize it, we'll then be able to move our database into that software.
COWIN, a medical database software, has been helping India track the rollout of its massive vaccination program. It works by aggregating the vaccination tallies from each of the vaccination sites. It is expected that the software will allow the local health authorities to visualize trends and patterns in the vaccination rollout in Guyana. Vaccination numbers released by the minister on Thursday revealed that 257,384 persons have received their first dose of a COVID-19 vaccine, representing 52.9% of the adult population, while 142,691 persons are now fully immunized, representing 29.3% of the adult population. Reporting for the HGP 90 News, Kendell Richmond.